Hello, this is Dr. Stephen Weiner, and I'm going to show you today how I use Hyperdilute Radiesse to improve laxity in the legs, and then I'm going to use Renuva at the end of this to show you how I improve a liposuction defect. So the mixture I use for Hyperdilute Radiesse of the legs is 4:1. That includes 2 cc's of 2% lidocaine, 4 cc's of bacteriostatic saline, and 1.5 cc's of Radiesse. I also use a 22 gauge 70 millimeter cannula for this. So initially the patient is marked while she is standing up to get the areas of most concern to the patient. She is then laid back onto the table. When I inject the Hyperdilute Radiesse, it must be done in the immediate subcutaneous plane. Studies have shown that this plane gives the maximum benefit of collagen stimulation as well as elastin creation. If you are too deep in this area, you will be in the subcutaneous fat, and there will be minimal stimulation of both collagen and elastin. I do a fanning technique to disperse the product evenly throughout the areas of concern. I will approach some areas in a cross-hatching technique from different directions. It is important to know that you should use one syringe, which is 1.5 cc's of Radiesse per 10 square centimeters that you are treating. 10 square centimeters is about the breadth of a person's hand. So during one treatment session, as we did in this patient, we used a total of 3 syringes of Radiesse. It takes about 3 or 4 months to see the maximal benefit of this treatment. We'll often combine this treatment with RF microneedling, such as Genius, and we will do this at the same setting. There is no danger to the filler with the RF microneedling. Typically, 2 to 3 sessions are needed per patient. So now I've changed over to Renuva for a hip defect. Renuva stimulates your body to create fat, which gives a very long-term solution to defects. So Renuva comes from donated fat, and it is processed to remove all the living fat cells and completely sterilized. What is left is the fat matrix, as well as all the important growth factors to stimulate the body to create fat. So Renuva comes in 1.5 cc and 3 cc syringes. In this case, I'm using a 1.5 cc syringe mixed with 3 cc's of saline mixed with lidocaine. Renuva is a very viscous product, and it requires a very large cannula for injection. In this case, I'm using an 18 gauge 70 millimeter cannula. While there is some correction due to the matrix being injected, the full effects takes around 12 weeks for the fat cells to be created from this injection. This is also a process that takes 2 to 3 treatments to get the best effects.